Testing
Hi,
1,
everyone.
2.
Welcome to this month's chat. There's one person that I heavily depend on every month to get these meetings up and going, and there's no way I could do it without him, and that's our friend Luis. And today happens to be Luis's birthday. On the count of three, can we all just say happy birthday to Luis? 1, 2, 3. Happy birthday,
Happy birthday.
Luis. Oh, birthday to you. Happy birthday to Luis. Happy birthday to you. Yay. Thank you, everyone. Happy birthday, Luis. Thanks for all you do for us. Okay, we have a full agenda today. First up, we have representatives from SPECSA to talk about a pilot that White Sands is doing with them, partnering as part of our health span initiative. And then we have Dr. Gibbon and Dr. Rowie here to circle back on the previous talk we had regarding concierge medicine at White Sands. And then I will give you an update on just some happenings around the community. So first up, let me introduce, we have Spexa Tandon, who is going to represent Spexa joining us. She is the Chief Resilience and Partnerships Officer at Silicon Valley Exercise Analytics, also known as Spexa, SVEXA. And she serves on the board of directors for Bridges of Sports, a nonprofit organization leveraging sport for social development of the Sidi tribal community of India. She is an Olympian swimmer and represented India in the 2004 Athens Olympics, an Arjuna awardee, and has won 37 international medals for India. Shika holds 2 Masters of Science degrees in biology and biotechnology and a Bachelor of Science degree in biotechnology, genetics, and biochemistry. In her professional career, she has combined her academic knowledge and athletic experiences to work as the science program lead at the United States Anti-Doping Agency, or USADA, and in product management at various fitness wearables and technology companies. Also joining her is C. Mikkel Matson, PhD, who is the Chief Executive Officer at Spexa with 25 plus years experience working with elite and recreational athletes in a variety of sports, and 20 plus years of experience in research and creation of physiology algorithms. He received his doctoral degree in medical sciences and exercise physiology at Karolinska Institute in Sweden and has conducted research at Stanford University since 2013. Dr. Matson has written several books about endurance training and training planning, and he is frequently invited around the world as a speaker on exercise analytics, precision health, endurance training, sports genetics, and mobile health. So without further ado, let's please join our Spexa guests. They will be joining us via Zoom.
Thank you, Shelly. And hi, everyone. So I'll be presenting. Let me just quickly share my screen real quick. Let me know once you can see that, okay?
Yep, good to go, Shika.
Perfect. Yeah. So hi, everyone. I'm Shikha Tandon, like Shelly mentioned. I lead the partnerships team here at Spexa. So big thank you first off to the Human Good team and Shelly for inviting us here to share a little bit about Spexa, how the tech works, and basically what we are collaborating on with Human Good. So as you can see here on this first slide, as it says, Spexa is the intelligence layer for health and performance. Now, what does that mean and how does it work? So over the past 3 decades, the Spexa founders, which includes Michael, who Shelly mentioned, he's one of the co-founders as well as the CEO. They are all experts in human physiology, genomics, precision medicine, and they've basically done a lot of research in health and performance optimization. So what we've done is, from this research, Spexa has developed algorithms, or essentially think of it like pieces of software that we then license out to other companies. So in this case, think of it as Svexa is licensing some parts of this technology to human good. And what does it do? How does it work? Um, it uses available data. That data could come from smartwatches, it could come from biometric or health metrics, it could come from subjective input, it could come from forms, it could come from anyway, any other wearables. And what we do is then we analyze it. So all of this data flows into whichever company we're working with. They ideally might have an app or a platform, so they're collecting all of this data on that app or that platform, and then the Swexa's technology is working in the back end, so which behind the scenes essentially of this platform. And then it analyzes this data, and then it gives each individual user of that platform individual insights, recommendations, and these can include things around reducing injury risk. It could include things around optimizing training or any performance, or just improving health and wellness metrics. So here, again, how is all of this, what I just mentioned, applicable to senior living? So there's a lot on this slide, a lot of text on this slide, but essentially it is that the problem that Svexa was solving for elite sports about, 10 to 15 years ago, we're seeing that the space of senior living it's very similar today than what sports was 15 years ago. And that is that a lot of us have access to smartwatches, have access to some sort of data gathering apps or tools, in our everyday lives. And it could be things around sleep, it could be things around step tracking, it could be things around heart rate. And the challenge is that most people see these numbers, but they don't know what to do with it. They don't fully understand what that means for for their health, and how that translates to themselves as individuals. And so you might get generic advice. You might see, if you open up any of your apps that you have on your phone, you might see graphs. Uh, but that generic advice or the generic data that you see doesn't necessarily work, because every one of us is different. And so that's where companies like Svexa come in. We basically take that raw data that you have, that the companies have, and then we turn that into something that is clear in terms of insights, which are again personalized to that individual. And so they're all easy to act on. So instead of just those numbers, you actually get guidance on uh, on what your body needs for that particular day, what it needs to stay healthy, to stay active, to stay aligned with your goals. And it's essentially just answering that question of what should you do today. And we've had a lot of success over the past few years implementing this within sports and fitness across different levels, right from recreational all the way to elite. Uh, this is a really fun slide. Michael and I were at White Sands earlier this year. Was it earlier? Yeah, it was earlier this year for the Big Connect. And as you can see here, it shows the similarity between the resources that are available on the top at White Sands, and the row at the bottom is basically a pro or an elite sports team. Both have access uh, to a fitness area, to a dining hall, to some sort of community or recreation space. There's a gym or an area where you can work out, or a space for physical activity. And so there are a lot of similarities in terms of what you have access to. And so we're going to be leveraging some of these resources in a similar way that we have done in the past with sports teams. Uh, so in terms of, how can Svexa translate what we've done in sport to senior living? As it says up top, seniors are probably the second most measured athletes. You have a lot of data, especially, or access to a lot of resources, right? Especially around and in places like White Sands, where it's when you think about performance, when you think about health optimization, there are a few core pillars uh, behind any sort of intervention in this space. So they could be things around, and you can see they're very similar in both verticals. So on the left is the sport and elite athlete side of things, and on the right side is the senior living. So there could be personnel that are guiding you with diet, with health, with social well-being, cognitive health. And from a Svexa standpoint, what we are hoping to do in this with this pilot is that we'll focus on the activity and the movement vertical, uh, while keeping in mind and keeping in context, when we make the recommendations, we'll keep all the other pillars in mind as well. So it's not that we're ignoring them, but we're taking into account all those different things along with the activity and the movement. And that's what we'll be recommending as part of this pilot. So a quick overview of the pilot and how is all of this going to work? What is the purpose of it? It's really to use White Sands as a testing ground, really. The purpose is to augment what you at White Sands and Human Good in general are already doing or already have access to. So it's the same facility, the same personnel. We want to, maximize using and keeping things similar and familiar. And on the right side is there's this little loop that you can see. So that's basically from the data perspective. What we'll be doing is we'll be leveraging existing smartwatches, existing tests, and that test could be any sort of functional test that you all do or any intake questionnaires that you have. And as a whole, our goal is really to investigate uh, whether we can build out and automate this whole system that you currently have with regards to activity and fitness at White Sands in a way that it can be scalable to more people while still providing the same level of care and benefits to everyone. So on the right, like I said, it's a very high level workflow of the pilot. We plan to do it for 12 weeks. There will be a pre-assessment and at the beginning of the 12 weeks, and then there'll be a post-assessment after the 12 weeks. Each participant will share their smartwatch data as well as their fitness goals and preferences with Svexa as well as the Human Good team. This could include activity, sleep metrics from the smartwatch. It could include preferences such as what types of activities do you like to do, how often in a week do you want to exercise, do you prefer group classes or personal training, do you prefer aerobic activities like walking or swimming, or do you prefer lifting weights, do you like doing yoga? So all of this is what y'all can input to us, and we use that as a reference when we make these recommendations. And how we'll do it is also on a day-to-day basis. We will also have each of the participants fill out a subjective questionnaire. So with this, we get access to, on a day-to-day basis, things like your mood, your nutrition, your energy levels, if there's any injury or illness that we need to take into consideration. And so we use all of these different inputs, and then we generate a daily activity recommendation for that particular individual. And like I said, these goals, or sorry, these recommendations will keep in mind any goals that you have that you might have shared with us. And these could be things like you want to improve your strength, or you want to improve your aerobic fitness, or you want to improve your balance. And so from a Svexa analytics standpoint, we will run these analysis every single day with every new uh, data or input that we get for the individual. And then we will use that to modify or adapt the recommendation for that day. So for example, if someone didn't sleep very well, you can report that to us through the subjective input, or we might get that data directly from the gadget, and then we know that we maybe modify the recommendation where you don't have an activity that is as intense or something that doesn't overstrain you. And so we basically go through this whole loop every single day for the duration of the 12 weeks. At the end of the 12 weeks, as I mentioned, there will be that pre and post assessment. So one of the outcomes that we will measure is any improvement in health or fitness metrics. It could be strength, aerobic fitness. We'll also plan to monitor qualitative outcomes that could be functional movement or just general quality of life. And as much as the participants want to share, we can compare the before and the after. As I mentioned earlier, from a tech integration standpoint, we're also using this to evaluate the technology on some level. And if it is successful, we're hoping that we can have a deeper integration between what Swexa's technology has to offer and whatever human good, the platform or the service that y'all are using in-house. And so that way it can be offered to all the residents across different communities. So from a next step standpoint with regards to the pilot, there will be a sign-up sheet where anyone can express interest to participate in this pilot. And I think Human Good will be probably handing these out today, and then we'll work collaboratively to make a final selection on the participants. So yeah, please feel free to express interest. And thank you. If you have any questions, I'm here to answer them.
Thank you for your presentation. The question I have is, when are you planning the pilot so that it fits the schedule of who volunteers? Because
So at the
I would
moment,
be interested,
Sorry,
but I have a complicated schedule in the coming months. So I need to know if I can fit 12 weeks before I engage in some of the other things. And I think other people here have the same situation.
Yeah, no, that's a great question. We plan right now to start the pilot on the 22nd and have it run through mid-December for a total of the 12 weeks.
Did you all hear that? It's starting on September 22nd and it's going for 12 weeks. So just as a recap, they're using analytics to optimize your health. And I like the tagline, senior living, the second most measured athletes. We'll have to add that to our marketing materials. Any other questions for Sexa?
Yeah. Do you need to be on site at all times in that?
Do you need to be on site at all times for those 12 weeks? The answer is yes. Sorry. Dr. Given.
Hi. With individuals wearing the smartwatches and that sort of thing, if you pick up anything abnormal, how is that communicated to the patient? And abnormal in the sense of needing potential further intervention or investigation, abnormal heart rates, that sort of thing.
Michael, correct me if I'm wrong, but I think here we're looking at it more from a activity optimization. So we're trying to stay clear of the medical side of things and using it more on the health and health adjacent insights.
Yeah, that's absolutely correct. And from the typical variables, the only thing you will see or get are atrial fibrillation notifications. And obviously we will see that as well. And that will be to the care provider.
I'm sorry, did you say that would be communicated to the care provider?
Yes, to the human goods team and the care provider.
So they'll notify us, doctor.
Yes.
Any other
But
questions?
that is only one out of all possible issues. So you don't see many of the medical aspects on the variables.
Okay, thank you. To sign up, please contact Nicole Scribner. She has a list. You'll need to email her or call her to get on this list. There are only 10 spots, so the main criteria is you have to have a smartwatch, like an Apple Watch, a Garmin, or a Fitbit, and you have to wear it 24/7. It has to measure your sleep as well. So if you don't have that, you're automatically disqualified. And you have to be here because we have a special scale. It's called in-body scale. That's part of the process. And Nicole's really taken the lead, and kudos to Nicole for everything she's done with this. So she's your point person here. Any other questions for Svexa or any questions on the pilot? Anything in the chat?
I think they've been answered.
No, okay. Okay, thank you, Svexa team.
Shelly, there's a question in the chat for Shika. Shika, I have a heart disease that will prevent me from being involved. They can participate, correct? We just can't use the in-body scale.
Yeah, there will be certain, when they onboard, there will be certain places where they can make notes on if there are any medical conditions or if there are any injuries that we need to be aware of. So they can input that in there.
Perfect. Okay.
But I
Bob,
think
the
from a medical standpoint, we might have to just make sure that we have clearance that like
Okay,
the
thank
person's
you.
okay to participate.
Thank you, Shika.
Yep.
Okay, anything else for the Svexa team? Nothing else in the chat? Nothing else, okay. Okay, thank you, everyone that participated. Up next is Dr. Given and Dr. Rowie, and we will give a recap of this concierge medicine. Yes, it's on the flash drive. Do they both have microphones?
Yeah.
Thank you. You'll need to forward your own slide.
Thank you.
And then we have about 70 people on Zoom. So whoever's speaking, if you can stand in front of the camera
Okay.
and they can see us. Thank you.
Like since the last time we spoke, or do you want
Yeah.
to sure? It's totally changed.
Slides, I thought they would say that.
Oh, okay.
Yeah, give a recap.
Because it's been a while since when did we first?
Months now, so-
Months, yeah.
Yep.
Sure. Hello, everybody. Hi. Good to see everybody. Again, I'm Dr. Rowie. Of course, you know Dr. Given. It's been quite some time since we initially had this and the initial conversation of how are we going to continue to sustain providing services as a practice as a whole. This is beyond just here at White Sands as well, but White Sands is unique to us because in our practice, Dr. Given is here essentially full-time, just dedicated to this community. Whereas in our other communities, we have a lot more nurse practitioner involvement. And so we wanted to be thoughtful and try to figure out a method in which we can continue providing this level of care here at White Sands as an option, but of course not as an obligation. So the reason it's taken us a little bit of time as well to come back and have this conversation is we wanted to really survey the community in San Diego as well and see how do other people do this and what are the price points at which this is that can continue to provide this level of care. And so we wanted to come back today and kind of present that information, recap, why we've gotten to this point. Present kind of the information that we've learned as well across the county, and then present what we've come up with in a transition into a concierge model for Dr. Given. Does that sound about right? Yeah, okay. So again, this is about sustainability. This is not about trying to remove Dr. Given from here or trying to, of course, force anybody into any type of model, but just again, an option for us to figure out sustainability. So currently the way the clinic runs is Dr. Given is the primary physician there 3 to 4 days a week from 9 a.m. to 2 p.m. And we try to get those of you in same day or next day as quickly as possible, trying to provide that quick access to care. And then, of course, when Dr. Given is out, or if Dr. Given is sick, we've had from time to time a nurse practitioner from our team filling in, or sometimes you've seen me fill in as well. And again, we're really focusing on comprehensive care, not the typical primary care where you're going out to the clinic, which is a 15-20 minute visit, but rather full geriatric comprehensive care here on site. And then Dr. Given does communicate with staff after hours when urgent needs arise, as do I as well. And our current limitations, let me bring these up here. So in traditional primary care practices, doctors have a pretty large panel, and they're seeing anywhere around 2,000 to 3,000 patients. And you've probably been in some of these appointments before where you're rushed in, you're rushed out, it's a quick visit because that's the way they can be sustainable. Whereas here at White Sands, in the clinic, we see approximately 120 residents in the clinic, and about the 20+ residents in the care center. So again, we're trying to figure out, how do we make this sustainable for a doctor to be here for 120 residents? Because from an insurance standpoint, it's getting really challenging. And we've seen a significant reduction in Medicare reimbursement, even in the last 20 months that Dr. Given has been here in the clinic. So yeah, the reduction, and we have another rate reduction coming for 2026 as well. So again, a comparison of the difference of the care we're trying to provide here and figuring out how do we sustain this compared to traditional primary care. Now, we are essentially practicing as a concierge practice here in panel size and time and access to care. Some of you may have experience with some of the other concierge practices in San Diego, or may even be members there. And those, we'll have a comparison slide here as well. But so these practices, typically what they do is they subsidize that increased amount of time and accessibility with a monthly recurring fee, in addition to still billing insurance for the medical care itself. So the time that, and it's kind of crazy. I mean, how do you really take care of people if you don't have the time to call families? You don't have the time to sit down and talk about prognosis and disease progression. But a lot of these things, actually, Medicare doesn't reimburse for. And what they typically say is, if this is routine stuff, if you had a question, just wanted to say, hey, Dr. Given, I have a question about this medication real quick, or something that is not an acute ailment, that's technically not something Medicare will reimburse for. So healthcare, unfortunately, has really gone downhill. So lower patient panel sizes, and again, the accessibility to the provider for concierge practices. Do you want to step in here? I don't want to do all the talking.
So what we have kind of laid out after looking at what's in the community, what we can be offering here, we've come to basically a model that includes 2 tiers. We've called them the first, which is a core tier, and a second exclusive tier. And we will go into those. So before we go forward, as a reminder, I we are not employed directly by White Sands or Human Good. There is no requirement for any of you to sign up. And we would never discourage anybody from going to an outside provider. For, gosh, probably a dozen or more, I'm actually just a secondary or backup physician. What we also didn't want to do is say that, okay, to see the, to use the White Sands Clinic, it's going to cost money. And if, nobody's enrolling, or if that person doesn't enroll, then they can't get care here. So we also didn't want to leave anybody without options for using the clinic here. So in order to do that, we are following a model which is taken by most other senior living communities that offer in-house care, where that care is generally provided by a nurse practitioner. And here, our plan is for those who do not enroll, that they would have access to the Aligned Geriatrics nurse practitioner.
Could you carry it into that?
Oh, okay. So the first core tier, some of this is going to look pretty familiar because, again, the way that I practice, the way that we've been practicing here is kind of, has a lot of concierge elements embedded within it already. So for those who enroll in the core tier, appointments would be during regular clinic hours with days and times. We can't right now, without gauging a level of interest, which we'll talk about later, I can't say, oh, well, I'm going to be here 5 days a week, 4 days a week. If, 30 patients, if my panel goes down to 30 patients, that's obviously not going to be possible. So some of this is to be determined based on interest. But we plan on continuing the ease of appointment scheduling, same day, drop in, next day, whenever that next slot's available, people get plugged in, we see them. On occasion, I've made exceptions and held clinic hours longer or come in earlier so that I can accommodate people that need to be seen that day. And that's something that would continue to happen. Although now I'm more supported in doing so rather than just saying, oh my gosh, I got to do what's right. And then, so continued close communication between clinic staff and the physician, including after hours and weekends, the continued unhurried appointments and coordinated care, the opportunity for increased communication. And this is something that actually I've been doing a bit more of in the last month, trying to get a gauge of what it feels like. So somebody says, oh, I can't get that appointment in a timely fashion. Well, I've been offering to make those calls and to try to, expedite those appointments. I've called people with their lab results after hours or on the weekends to inform them about the results and, what to do next. Again, I just started just throwing myself out there and doing these things that take time away from me doing other things professionally because I wanted to see what it would be like. And honestly, I love it. And I know that you guys do too. When I know for a few of you, you get a call and it's, huh, Dr. Given, what do you do? You know, so I want to do more of that. And then also for the courtier, there are additional options out there for mobile labs and imaging. Those things take more time of me or back office staff to get that set up, but we'd like to start providing more of that to you guys because, well, labs no longer come every day. They no longer come stat. And, you know, some of the mobile technicians doing other studies, well, maybe we want a better study done. So just basically rolling that out as an option for better care in those areas. The exclusive tier. This is basically, it's like having a doctor in the family. Direct 24/7 access to me, my personal cell phone, after hours, weekends, telephone, video, in-person, even in-person visits as indicated, and all of these being outside of clinic hours. When available, direct involvement with me, calling physicians in the emergency room, getting on video chats with those physicians as the patient's being seen, whether that's in the hospital, ER, or skilled nursing facility. And also, I'd like to have the opportunity to start accompanying people during specialist visits, either by calling in through video conference or just joining them in person. These are things that I have done and am doing for currently a select group of people. And I have currently on my panel 6 people outside of here that are basically where I'm practicing in this capacity. And I know that they really like it. You know, show up at their house at 9:30 at night for acute back pain, see if they actually have to go to the emergency room, those types of things. So in our research around town, concierge services, really, people put a label on concierge services, but it means so many different things. For instance, at Proman Clinic, you can get concierge, although one of their 2 concierge programs is closed. However, what you get is a concierge line to a non-medical triage personnel. After hours, it may be a medical person. And next day, same day appointments or calls back, that may not even be the person's physician. Proman Clinic is heavy in nurse practitioners, and you know, some of them are great. It's a great option. And that's how they are able to offer, you know, they say, oh, you've got your doctor's cell phone number. Well, kind of. And it may not be the doctor that you see when you need to see your doctor. UCSD, $4,000 a year. I have taken care of patients who are in this program, some, you know, perfectly satisfied. Others, when I try to get a hold of the physician, I actually am directed to the nurse practitioner. That's happened on occasion, but, you know, they still carry a panel of patients between 300 and 400 people. There is also a further upgrade that UCSD does not advertise, that I believe it's anywhere between $8,000 and $11,000 a year. That physician she has said that she's only going to be taking 100 or 150 patients. So it frees up time for even more individualized care. And what that tells me is that people sign up at $4,000 a year and they say, I want more. At Scripps, again, there are 3 or 4 tiers ranging from 4,600 to 8,100 a year. And they still carry a panel of patients, 300 to 400. And there's a big wait list, and there has been for about a year. MD VIP is out there. Source MD is all out of pocket and cash. And what they do is they say, here's your monthly fee. Oh, if you want a house visit, that's an extra $500 for the first 2, and then it's $1,000 per home visit thereafter. It's all cash based. MD squared, the kind of highest level or tier that we've come across. Those are 2 physicians highly sought after from Scripps and from UCSD, and they only take 50 families a year. It's $3,000 a month. They will make home visits if it's absolutely necessary, or visits outside of their clinic, which is very nice. But they have a lot of stuff in their clinic. It's very nice. And then Pacific Pearl, hard to get consistent information. I've heard of, different price points, and depending if you want Mimi or somebody else, it varies. Those are what we're coming across. Basically, there is no concierge practice that offers mobile visits less than, I think it was like $11,000 or $12,000 a year. So what's that? So what did I say? Oh yeah, there's no mobile concierge practice that we have found that will consistently make home visits for less than $11,000 or $12,000 a year. So,
these and the comparisons of what we've been finding is that the practices in town that are still providing this level of care are all clinic based. You're still going to them, to their clinic. Whereas we still see the value and the need of being on site in our communities for I'm biased. We're biased because we do this every day, but we feel being on site, being accessible is that much more important and valuable than even what these offerings are.
all right. So this is what we came up with. So for the initial core tier, $300 a month. And the exclusive tier is $1,250 a month. Again, the difference, probably the main difference being in the exclusive tier is the 24/7 direct access to this, and the opportunity for late night home visits and, weekend video visits, whatever it is that's necessary, accompanying people to their physician's appointments. And again, I already have a panel of about 6 patients on that outside of here.
And we see that probably more likely for people who live at home privately, who don't have a lot of support, who don't have a lot of additional resources there in the home. The other caveat here too is Dr. Given is talking about continuing to do telemedicine, video visits, phone calls, and this has been really big since the pandemic. Well, we're at a turning point again where at the end of this month, Medicare so far has not, or the government has not said that they're going to continue to extend telemedicine as a covered benefit. So at the end of this month, we may lose that completely. But again, in a concierge model, we can still do that because we're subsidizing that time and the cost for that.
All right, so next steps. My hope is to sort of gauge interest and put out this projected date of switching over October 1st. There is some sign-up info. We're going to be hanging around after to answer more questions, and talk to people. There will also be a sign-up sheet in the wellness clinic for those interested. Leave your name, number, and contact, and then
even if there's questions, just interest in wanting to, talk privately, please just call us. And we want to give everyone plenty of time so that this is a smooth transition, and the ability to ask more detailed questions. We do have legal paperwork, we do have a enrollment packet, and you can read through all of that if you have interest in taking one home. And then again, based on the interest with Dr. Given and based on continuing care in the clinic in a non-concierge model, we will still provide one of our nurse practitioners. Some of you may have met her before, and ensuring that you're still receiving care so that nothing gets dropped. But again, none of this is obligatory, and we're just trying to have like an open, honest dialogue of kind of where we're at in our sustainability.
For what it's worth, I'll throw this in there. This is incredibly difficult for me. I know it may be for some of you as well. I've grown to really connect and care about everybody that's come through the clinic. And I didn't realize how difficult it would be until, having some side discussions even before today and knowing that people wouldn't be continuing on. And that was hard. And I am willing to, talk to people, hear anybody out, and discuss any of this further. But I just wanted to throw that out there.
So how does it impact the health center?
It doesn't at this point. Is the question was how, if at all, would this affect the care center? And at this point, it doesn't. I'm going to still be the physician for the patients up there in the care center. I don't know if that model will change to, a physician-backed nurse practitioner type of thing where there's some alternating. Some of that depends on how busy this gets. If there's a lot of interest, my work happily goes up, then, there may be changes, but at this point, there's no plan to make any changes.
Question here.
First of all, let me just say that I think I've not been here very long, but I have a healthcare background and I am your patient and I'm a healthy woman. And I think having you here is so important. Having White Sands have a almost resident physician is A, unique, but B, really important as we age. I am very impressed with your care, and I know you do speak to patients, you speak to us, and you also listen to us. Given all that, that's a good pun, isn't it? I would like, first of all, what do you do with families where you have two people and one is pretty well and one is not pretty well? Can individuals, is this an individual question of signing up? Or is it a family question? That's number one. Number two, what is under this the support you'll get with either a nurse practitioner or somebody that has access to the records when you're not here, so that it's seamless with the wellness clinic? And how do we help in your coverage of even just the fact that we need to know about having to give help with your malpractice coverage or malpractice concerns, because that also changes and it's a big impact on your ability to increase your income.
So I will, actually, my malpractice insurance renewal comes up. As far as I know, there shouldn't be very much change to that. That's just, it's being taken care of. The other is, what support would I get? TBD, right? If 15 patients sign up, well, I can handle that myself. If 25 patients sign up, probably handle that myself.
But also, I just want to chime in real fast. You know, here it's also very unique at White Sands because you have an amazing team here. Shelly, Venus, Rolene, the entire wellness clinic staff is so involved and do such a wonderful job. This is not the norm everywhere. The level of support you have here is tremendous. Our other communities, most of their wellness staff are not involved like this. So the communication happens with our back office staff. And so some of you may know Selma back there. She runs our back, all the office and operations. And we have staff in the back office, so you will still be able to call us directly as well to support you. So that's how we coordinate in our other communities already.
Yes, I have two questions.
Sure.
One, when will all of this material be available to us? And number two, how does this dovetail with Medicare?
Good questions. The first question is, we have what?
You can send out the PowerPoint right after.
Right. She can send out, Shelly can send out the PowerPoint, and we have a flyer or letter that we were going to pass out to all of the Aligned Geriatrics patients and their families to ensure that they get all of this information. With regard, with regards to Medicare, we still bill insurances. The additional fees go to non-Medicare covered services. And so visits will still be billed as per usual.
How many people are you going to have signed up in order to make this work? I mean, let's say you have 120 patients on the roll now.
Yep.
Supposing in an extreme case, only 20 people sign up for the concierge care. Is that going to be enough to sustain it?
Probably not. But right now, there wouldn't be much change because well, I think of what I would do in that case. I would continue with those 20 patients, and I would work hard outside of the community to build the concierge services that, you know, that I've already begun to build, maybe at other communities, that sort of thing. So I think it depends. I don't know yet the specific answer to that question, but I can tell you that right now, there is no plan on, oh, if only 10 people, I'm out. I got nowhere to go. So right now, to be perfectly frank, so for right now, I'll take them.
It's also the time, right? It's like, depending on, I think it's depending on volume, depending on interest, then that will equate to how much time, how many days that Dr. Given is here as well. So lower volume, less frequent days, higher volume, more frequent days. And then we'll also supplement that with a nurse practitioner as well.
There was an earlier question you didn't address, which was
Sorry.
How you treat a family of two as
Great,
opposed
yes.
to just straight individuals.
Honestly, we did not broach that. As it stands right now, it is an individual price as it stands right now. I am open to furthering that discussion. I know that obviously there are a lot of couples here, but the other thing is this. To Dolores's point, Donnie's point, if one person, is quite healthy, I see them twice a year. The other I'm seeing, every few weeks. I don't know if I can give a thought right now to how to price out every individual according to their needs across 100+ patients. So for right now, I'm just going to say that it's an individual price, and if there are issues, we're open to hear you out.
Hi,
Hey,
I have a clarification question. For those of us who carry secondary insurance, which is rather expensive to bolster Medicare, how does that fit in with this? And I just don't understand where we're going if that's the case.
so you might be able to talk to this better. But
So Medicare, of course, covers 80% of your medical costs. And then your supplemental covers that other 20%. This would be in addition to your medical plan, your medical insurance. So the visits the clinical care that you receive is still being billed to your insurance for that clinical care. There are nuances, and this is in the enrollment packet. It'll explain these nuances between what are billable services to the insurance and what are not. Oftentimes the work we're doing are not reimbursable services and we're just doing them. So if we build Medicare for everything that we're doing, they would say we're committing fraud because they don't technically cover those services. And so that's why, these practices gets a little in the gray. But the clinical care is still so the way Medicare defines this is it's necessary medical care, not routine. And so again, it's very nuanced and we've had to,
So this is over and above regular care. Elizabeth and these patients of Dr. Given
That's right.
would still continue with regular care, which would be covered by insurances.
That's right.
And whatever insurances are covered, we pay. But where does this fit in? And that's the case now.
You may want to repeat
I
it.
think concierge care is.
Right, so for individuals with Medicare and a supplemental insurance, without the supplemental insurance, ICU, we bill Medicare. Medicare charges you 20% for that visit. Okay, now you have a secondary insurance. You come see me, I bill Medicare. Medicare pays out 80%. Your supplemental insurance will pay out 20%, and that's it. All of this is in addition and on top of that.
So we would see you for
Abram,
quote unquote
Abram.
normal services. And this fits in a level above that, actually a level and then another level.
Right, so you're right. So say you wanted to come in for your Medicare wellness visit, your annual wellness visit, which is billed to Medicare as a routine visit. There are other visits or other times where Dr. Given will be engaged, talking to you, giving you advice that he will not be able to bill for those services to the insurance. So the insurance doesn't cover the costs of that stuff. And so you would think that the insurance should cover it, but in fact, it does not. And so there are times where if you come in for a routine visit, say you're feeling fine and you just wanted to come and talk to Dr. Given about some advice on a, future possible medication, or your family member is going to have surgery, you want to talk about advice and get a second opinion, that's not technically a reimbursable visit by your insurance.
I understand your financial problem, but I don't understand how this affects medical care exactly. Because my relationship with Dr. Given has been wonderful, but I don't hold back on anything and he doesn't hold back on anything. I'm sure it's the same for everybody. This changes that relationship. Unless you do this special care, does it change the relationship?
Meaning in the care that I provide, I always provide that care. And I do so at a loss generally. But the medical decisions I would make, the advice I would give, all of that, I don't see changing. It doesn't change. Now, if you're saying, oh, if I don't enroll, but I want medical care, does that change our relationship? And this is the hard part. Yes, I won't be the physician seeing that individual that doesn't enroll. That would be through our aligned aligned geriatrics nurse practitioner.
Did that answer your question, Abram?
So that means that if I don't sign up.
Here.
Does that mean if I do not sign up for concierge care, even if I got this double insurance coverage, our professional relationship stops?
That's it. Yes.
Hard thing to say.
Yeah.
Okay, you've answered my question.
I have another quick question. My husband goes to the VA and is covered with just about everything there. But he does, if he were to fall down here, would he have a coverage here? If we don't take out coverage for him?
if I'm understanding, there's a patient that is already being seen in our clinic and falls here.
He goes to the VA for his medical things, but about a couple weeks ago, he fell down and they took him right to the clinic. Would he have that service?
That is, yes, yes. The White Sands Nursing Care Clinic
Okay.
is the same.
Okay,
That
helps.
does not change.
thank you.
Okay. One more question, then we'll move on. Sorry, I'm gonna give it to Carol. Doty.
I just want to say, but to your point there, you said, oh, but without a doctor. However, technically, everybody has a doctor, even if they don't come to see me. Right. However, in that case, he falls, he goes to the clinic. I don't see him anyways. Even without this, I don't see him because he's not my patient. Right? And, and that's why there are residents here who have come preemptively and established to say, I'm going to keep my outside medical care. However, if something happens here and I want to see you on a semi-urgent basis where I'm not in immediate need of emergency care, and I want to come see you, they have established, I have an established relationship. They are followed outside. I may not see them for 8 months and then something happens, or, ooh, I've got a UTI and I can't get a hold of my outside doctor. I can see them because I have already established that relationship. However, that is no longer going to be the case for, residents who already have an outside physician, unless they did want to continue with me in the concierge model. Does that make sense? Yeah. Okay.
Yeah, well, I think it's getting clearer, but let's take an example, a case study. So if we're here and we didn't have the concierge system, and let's say, for example, your ear hurts and you think you have an ear infection, so I would still I could go to the wellness clinic and I could have someone, a nurse practitioner or someone
Mhm.
check the ear then? And there would be a nurse practitioner?
If that nurse practitioner is here during the established clinic hours and has established a relationship with that resident, or that resident is willing to establish a relationship, not under this, but just how it would have been.
I'll say, short answer is yes. If you're not enrolled into Dr. Given's concierge program and you came in, you had an earache and the clinic is open that day for the nurse practitioner, she will see you.
And that nurse
Strictly
practitioner
insurance.
would be one
It's
from
still, yes, still part of our group.
your
Yeah.
group? Okay.
So in addition to Dr. Given, we have 6 other doctors, several nurse practitioners. Dr. Given is your lead here.
Okay, I still see some hands up, but we're quite a ways past our time here. I'm happy to walk the dining room tonight, as I do after every chat day, and answer any additional questions. And then Selma, will you stand up and raise your hand? Selma is here also to answer questions after the chat. I think Dr. Rowie and Dr. Given will be on standby here for a few minutes after as well to answer questions. I will send out the PowerPoint after my presentation and answer any additional questions you may have. Okay to move on, everyone?
Thank you.
Okay, sorry, I will try to be quicker. I have a couple of slides myself to share with you all. Can you turn it on? I will try to be quick. Okay, I only have 2 slides, so please bear with me. First of all, last week we had our unannounced survey from the Department of Social Services. They walked in, said, we're here for your annual survey, and we have a trainee with us, which is never a good thing. But we made it through. We have no deficiencies, and I want to thank everyone involved. The way it occurs, when they walk in, they talk to residents. They randomly select residents to talk to. They look through billing files. They look through business files, medical records, team member records. They walk the entire campus. They spend quite a bit of time in the clinic looking at medications, how we store medications. They look at water temperatures. They look at all of our licensures. So it's really quite thorough. And I know I see some of you here that they interviewed, and I just want to thank you for your time with them. Anyway, that was a good thing. So moving on, upcoming pool renovations. Everyone's favorite topic. The pool will be drained on Monday. So we're in this now. We've spent a long time coming, and we're in it starting on Monday. Pool will be drained. Quiet zones will be the chapel, the third floor lounge, and the garden room. And I want to thank everyone that's already completed the release of liability forms for the Chateau. Remember, we were able to use their pool from 8 a.m. to 7 p.m. And I will turn them in tomorrow. So if you've not yet filled it out and you intend to use the pool next week right away, please fill it out. We have more forms at the front desk, and we will get those to the Chateau tomorrow. I also want to thank the 48 people that filled out our survey regarding quiet time during the pool renovations. We will be temporarily moving quiet time to noon to 1 so that those of you that eat outside can continue to do so in peace and quiet and not have to hear the noise from the pool. So that will start on September 8th as well. So new quiet time starting on September 8th, Monday, of noon to 1. I do apologize to the couple of people that said they had to feel like they had to choose between eating and napping. I can't get past that, but I want to remind you that dining options are available between 7 a.m. and 7 p.m. So hopefully you don't have to choose between eating and napping. And then outdoor dining will be moved on Monday as well. So we'll be moving from outside of the bar area to the sunset patio area, which those of you that have been here a while have seen that setup before, because trucks will be driving in where the current dining location is located. So outdoor dining is moving effective Monday. My next slide, memory support renovations. We'll start on Monday, September 15th. We have to make some adjustments. I've sent out some messaging about this, but there are a few more tweaks that we have to make. We've been working with an architect and a structural engineer, and there are 3 planter boxes in memory support for those of you that have been in there, and they're causing us quite a problem. Apparently they are about 32 inches below the floor, 32 inches above the floor. They're made of solid concrete and rebar, and we're removing them. So we will be relocating therapy and Nicole Scribner's offices, and I'll send out messaging on where they'll be moved to. But we'll also be relocating the gym equipment while they take out those planter boxes, which is expected to take 2 to 3 weeks. So the gym equipment will be moving into the boiler room, which is on P1 at the opposite end of the hall from the treasure chest. And it's been there before for those of you that have been with us a while. There's enough space. We'll keep the doors open. There are emergency call buttons in there if needed. But again, I'm sorry, there's a lot of changes coming, including all the classes, because remember, we are taking over the exercise classroom for our memory support renovation and the art studio. So all of those classes that occur in the exercise classroom are being relocated. I sent out messaging about that prior. So please check the Sandpiper to find out where your classes are moved to. They're either in here or in the Jack Patton room. That's it for me. Oh, no, it's not. One more thing, very important thing. Don't tell him I forgot it. John Cochran is coming to visit on Wednesday, September 17th. He's the CEO and president of Human Good. He's graciously coming to fill in team members and residents on things that are happening at the corporate level I've included his schedule here. He'll be meeting with team members at 10 a.m., having lunch with team members at 11. And then please make a note that the Get It Straight meeting is changed for this month only. It won't be on a Thursday. It'll be on Wednesday, the 17th, where he will present to residents what is happening at the company level. Afterwards, at 4:30, will be a reception in this area for all residents, and then a dinner with the resident council. If you have questions for John that you would like him to answer, please email them to me and I'll send them to him in advance so he's prepared and he can speak on them in his discussion with all of you. And I've included my email there. Okay, again, I'm so sorry for keeping you all past the 1 hour time limit. It was a lot of information. I will walk the dining room tonight. I'm happy to answer any questions that you may have. I want to remind you that the clinic staff is not leaving. The nurses are there 24/7. The leadership is still there to help when needed. We hope to keep Dr. Given with us as long as possible. I know you all enjoy him, and I've never seen a physician spend so much time with residents. So we appreciate that as well. So thank you, everyone. Any last minute questions for me? Okay, thank you so much.